Hello, everyone. As we're waiting for the session to begin, I would like to introduce you to the Med Memo. The Med Memo is your one-stop guide to all things medical. You may be wondering, how does the Med Memo work? Articles or visual graphics related to all things medical will be posted weekly in the Med Memo's Instagram page. It is absolutely free of charge for premium members. However, if you're not a premium member, you'll have to pay a small fee of 5 ringgit. Access to the Med Memo is for your lifetime, and anyone and everyone can sign up for it. You don't have to be a Taylor student or club member. If you're thinking of applying to medical school or not sure what to do in the medical field, we highly encourage you to apply now because the Med Memo will prepare you for your future. Here's the Google form to register. This is to let us know your Instagram username so we'll be able to access the Med Memo. So as you can see on our screen here, you can scan our QR codes to follow our Instagram page. Good evening, everyone. Thank you for joining us here tonight for Know It All. My name is Vinashri, and I am delighted to be your host for tonight. I hope that you'll enjoy tonight's session and take away something useful from it. Today, we will be focusing on studying medical electives in New York City. And joining us here is Rebecca Ng, a fifth-year medical student in International Medical University. She will be sharing with us here today information about her school and her experiences of how she got to where she is today. So here's a rough idea on what we'll be doing tonight. We'll start off the event with a talk by Rebecca, followed by a Q&A session at the end, for everyone to clarify any doubts you may have. Feel free to type your questions in the Slido link provided in the chat box as we proceed with the event. Kindly refrain from typing questions in the Zoom chat box. Before we begin, make sure to read the housekeeping rules posted in the chat box and please abide by the rules, or else we will not hesitate to remove you from the meeting. Now, without further ado, Rebecca, the stage is yours.
Hi everyone. Thank you so much for joining us today, and I'm very honored to be here, to be able to share about my experience of doing my medical electives in New York City. Yeah, so if you guys have any questions, just leave it in the link and I'll answer it after this, okay? Just let me share my screen. All right, so can you guys see the screen?
Yes, we can.
Okay. All right. Before I go into the fun part of doing my medical electives in New York City, I would like to introduce myself a little bit. My name is Rebecca Ng, and I'm 24 years old. I'm a full-time medical student in IMU. I'm currently in my final year, and I'm also a part-time content creator. I create content related to life as a medical student, such as a day in the life of a medical student vlogs, tips on interview for medical students, as well as travel vlogs. So the reason why I decided to put myself out there on social media is because I want to break the stereotype that a lot of people have on medical students. So I'm sure all of you guys have heard before that, oh, medical students supposed to be all nerdy, like glued to your books and all. But I want to show that we medical students don't have to be all of that, and everything is still achievable as long as we put our mind and soul into it without having to compromise our social life or our mental health. So that is what I'm very passionate about. That's why I decided to start this journey as a content creator. The specialty that I'm interested in is dermatology, and it has been my dream to become a dermatologist ever since I was young. So this is just a rough idea about my timeline. If you guys are wondering, in 2016, I finished my SPM in 𝐊𝐧𝐸-𝐺V. Then I moved to KL to do my foundation in science for a year in IMU. Then after that, I'm very lucky to just start my medical student journey about a month after I finished my foundation in science in the same university, right? Okay. Okay, so that's that. And let's talk about the fun part of everything you need to know about New York City. So for medical students in IMU, when you reach semester 8, it's compulsory for you to do a 5 weeks medical electives. You can do it in country or abroad, it really doesn't matter. And you can also take this time to really explore the specialty that you're interested in. This is because you know, in Malaysia, we focus on only a few core rotations. For example, surgery, OBGYN, internal medicine, pediatrics. We don't really get the opportunity to rotate long enough in dermatology, radiology, pathology. So if you guys or if medical students are interested in that field, then this would be a great opportunity for you to go and learn more about the field that you're interested in, right? So this is also to gain more exposure outside of our current learning environment. For me, it will be Seremban because after 2.5 years of doing theory in KL, we moved to Seremban. Um, and then right now I'm in a more rural area in Batu Pahat. Okay, so out of all of the places that I could choose, why did I choose New York City? This is because number one, I wanted to experience working abroad. I've been studying in Malaysia my entire life. I didn't get the opportunity to, do any training program, and it has always been my dream to work abroad. I don't know, I always find it really fun. So I thought that this will be a great opportunity for me to take. Since it's a very rare opportunity that I get, right? And then another thing is that I wanted to learn about the differences in the healthcare system between the US and Malaysia. If you guys are not familiar, the healthcare system in US is very different. They rely very heavily on insurance. If you don't have insurance, you can't get treated. Whereas in Malaysia, it's very different because healthcare is very easily accessible to everyone and it's very cheap. And there are a lot of other differences as well. And since I'm thinking of, maybe one day if I'm able to, I would like to work abroad. So I'm just really exploring different options that I have, right? And then the last but not least reason why I chose New York City is because I wanted to travel. As all of you know, as a medical student, you don't really get long breaks. What more 5 weeks long, right? I know it's for medical electives, but at the same time, it's not really hectic because you don't have deadlines to catch up. And I just think that it's great to be able to travel. And also, I didn't mention this, but apart from 5 weeks of medical electives, medical students in IMU, we also have to do 3 weeks of non-medical electives. You can combine it. So that's what I did. I did 5 weeks of medical electives in a clinic in Brooklyn. Then I also did 3 weeks of non-medical electives, which involved me traveling around. So I made Instagram reels about the different medications that I can find in their local grocery store, pharmacy. Yeah, so because it's quite different. Like, for example, over here, aspirin is not over the counter, but over there, you can easily get it without any prescription. So that's what I did for my non-medical electives. Okay. Right. So coming on to the application process, I'm sure a lot of you guys are wondering, how did I get my electives? Was it difficult? So I will just run through how I got my electives. So first of all, as an international student, you can get your rotation through an agency that helps medical students get their electives, or you can apply it directly through the hospital. For example, if you want to go to NYU, you want to go to Yale, Harvard, Oxford, everything is possible as long as you have the money and um, you adhere to the timeline, because they have closing dates and they're really strict about it. Yeah, however, the reason why I went through an agency called ACE-MD is because I applied just after they eased the COVID restriction. So there were a lot of backlogs. They were giving priority to their medical students there. So they don't really accept international students. So yeah, so that's why I went through an agency. So as I mentioned, I went through 𝐴𝐧𝐸, and also the price range, I can't really tell you how much exactly it is because it really differs from agency to agency and through hospitals. So I would say an average about 1 to 3,000 USD for 4 weeks long. Um, for okay, if you guys are thinking about the inpatient setting, which is the hospital clinical experience, when you apply directly through the hospital, it's way more expensive than what you can get through an agency. So for example, if I'm not mistaken, if you want to do it in Stanford, it will be 4,000 US dollars for 4 weeks. And if you want Yale, I think it could go up to 6,000. I'm not sure. So yeah, so that's really crazy expensive. Um, okay, so the specialty that I did my medical electives in is hematology and oncology, which is a subspecialty of internal medicine. So you guys must be wondering, why did I go with internal medicine when I'm really interested in dermatology, right? Um, this is very sad, but honestly, it's really hard to get dermatology electives in the US. I have no idea why. And also dermatology is very competitive in the US. Like all the smart people will rush for dermatology because they have a better work-life balance, less hectic, paid well. So I think the opportunity for us international students to do our dermatology rotations over there is quite difficult. So that's why I just settled for internal medicine, since it's a great base to have as a medical student. And initially I wanted general IM, but then something happened and I had to take hematology and oncology, which is fine because I don't hate it, but I don't like it. But I'm fine with it. So I just went with hematology and oncology in Brook in oops, I didn't say the clinic name, but in a cancer clinic in Brooklyn, New York. Okay. And then for accommodation, I'm very lucky because I went with my sister. So we rented an Airbnb together. But if you guys are going there solo, or if you guys are just traveling with your friends and you can't really get a full Airbnb, then you can also reach out to these agencies because they normally have accommodation services that will provide alternatives for you during your time there. Okay. Right. So next up is about the US visa. So I've heard a lot of stories saying that it's really difficult to get US visa, but it wasn't really that case for me. I just interviewed at the US Embassy in KL and I got approved for the B1, B2 visa for 10 years. There are a lot of different types of visa. The ones that students go with is usually the B1, B2 visa or the J1 visa. Um, it's really confusing because some of my friends got approved for J1, but I needed B1, B2 because 𝐴𝐧𝐸 required the B1, B2 visa. So if you guys are planning to apply to the US, you really gotta ask your agency or ask the hospital that you're rotating with, what visa do they require you to have, because that's what you will be applying for. And normally they will give you like a supportive document that you have to bring to the US Embassy to prove that you're not doing something illegal. So yeah, so that's that. I went under B1, B2 visa. I think B1, B2 visa is for students who are like me, who are doing the clinical rotations and also traveling at the same time. If J1, I think it's more of like an exchange student program, like you go there for a semester to complete your, I don't know, something like that. Okay. All right. Okay, so next, I'll be talking about my life there in the clinic, in that cancer center. Okay, so number one is that we first have to check our duty before we start working. This is because there are a lot of medical students, doctors who are working there, easily about 20 to 30 of us. So since it's a small clinic, they can't accommodate everyone. So they split us up into two different shifts, like morning shift and afternoon shift. This is just to allow us to see more patients on our own and just to just to prevent the clinic from overcrowding, because one day we can see about 80 patients per day, which is crazy. So the duties that we have is vital room. If, for example, if you're on duty in a vital room, then you have to take the vital signs, which is really important, because when you're reviewing the patients on your own, you need to have that vital signs to see whether they're okay or not. And then consultation, that's my favorite, because that's when you get to spend a lot of one-on-one time together with the patient in a room. And then another thing is the front desk duty, where you need to call patient to schedule in the appointment, or there's this thing called the teleconsultation, where you have to call them and consult them on the phone. This recently started after COVID happened. Okay, so I'll just be talking about the consultation, since that's like the big chunk of what I did there when I was rotating there, right? Okay, so we have the opportunity to have one-on-one consultation, which begins at 9 a.m. This is something that I really like, because the doctors there, they really put their full trust on their medical students. Like they don't doubt you. Of course, they're monitoring you, but then they really allow you to unleash that doctor inside of you that you won't really get to do here in Malaysia. I feel like when you're in Malaysia, um even if you want to insert a granula, even if you want to do an examination, you have to ask first, right? But when you're over there, you're really free to do whatever you want. Of course, you won't be prescribing like cancer medications and all, but simple things, you are allowed to do that. Okay, so you call the patient in, and once the patient is in, you shut the door and the patient is yours. So it's really amazing to have an opportunity like that. And then when you're with the patient, what you have to do is you have to review their blood work results, their lab results, medications, as well as their disease progress. And because I'm working in a hematology and oncology clinic, I saw a lot of cancer patients, for example, lung cancer, colon cancer, um, rare blood cancers, okay, which is pretty interesting but sad at the same time, because I saw a lot of patients who are actually resistant to their treatment, and we have basically exhausted all of our treatment regime. So to break the news to them that, you know what, like from now on, it's just palliative care, is really sad. But honestly, it's an experience that I really treasure, because when I'm here, I don't get to break that bad news, right? Okay, and then after you review the patients, once the patient is out, then you have to update the electronic medical record, the EMR. So EMR is basically like your case files, but online. So in Malaysia, after you see a patient, you have to write down the progress of the patients in your case file. But then for the US, they upload everything online into the EMR system, which is centralized, which is more I would say coordinated and organized. It's really easy for the information to pass from one doctor to another. I think Malaysia started doing that as well. For me, I was working in Seremban HTJ. They also did that, but it wasn't like a full-blown established system yet. Other than that, we have to schedule the patient's next appointment, do referrals to other specialties. And if there is any interesting topics at the end of the day, we can discuss it with our peers as well as the doctor in charge. So in total, I would say we get to see 5 patients each per shift. So yeah, so that's basically what I did. I've inserted some pictures over here. You can't really see it, but that's basically the EMR system. You have to click on the patient's information, then everything will come out, just update it. And then that picture of the chair is basically the chemotherapy room. Okay. All right, so after everything, after rotating there about a month, was it worth it? Of course it was. It's something that I would never trade anything with. And however, as much as something is very good, there are some cons to it. But as you can see, it's only 2 points. It's very minimal, but it's huge at the same time, okay? Okay, so I'll just talk about the pros about it first. Number one, I get to see patients of different races and backgrounds. This is something new to me because in Malaysia, I'm very used to seeing patients who are Malay, Chinese, Indian, Sarawakian, Sabahan, and then maybe some foreigners like the Bangladeshis, Pakistanis. But when I'm there, I get to see a lot of patients from the Caribbean, for example, Guyana, Puerto Rico, Jamaica. So it's really interesting because when you have patients of different backgrounds and ethnicity, your disease epidemiology changes, and what is common here is not common there and vice versa. So you get to see a range of disease, which is very interesting. And then other than that, I get to meet colleagues and doctors from all around the world. So basically, students and doctors who are rotating there are mainly focused on pursuing their career in the US. So there are doctors who are already established surgeons. For example, I have a friend who is an orthopedic surgeon in India, from India. So he's a surgeon for I think about 5 years. Then he completely ditched everything that he has and he moved to the US to start from scratch. Okay, so it's really interesting to learn from people who are way above me. And also the reason why I like to work over there is because there's no hierarchy system. Like even though you're a medical student and even though you're really new to the system, they treat everyone fairly and equally. They respect your thoughts, your opinions. They don't really downgrade you. And yeah, that's something that I don't really have here. I bet you guys can relate as well, right? And then other than that, I also get to familiarize myself with the US healthcare system and also the residency application. This is because I am still not sure whether I want to do my I'm not sure whether I want to pursue my career in the US, but it's really interesting when I'm there because it was the application season for the residency. So all of my friends who are applying that year, they were like filling up their forms and getting their letter of recommendation signed. So it was really an eye opener for me to get to see what they go through before getting myself into something that I don't know anything of. Okay, so that's really nice. And then also I get to network with the US healthcare professionals, which is something very important, especially if you think of establishing your career over there. Especially for me, I don't know anyone in the US. I have no connections. I'm gonna be the first doctor in my family. So literally I know no one and I'm starting for zero if I want to be there. So it's really great to just build your network with the doctors over there, which will be a great help with your residency application. Okay. Um, Okay, so coming to the cons of doing my electives in the US is first of all, it's super expensive. I won't go into details about how much exactly I spend because honestly, I didn't keep track. I just know that a huge chunk of it went to the accommodation because I picked New York City and the rent in New York City is just crazy. Um, but apart from accommodation and apart from your electives, you got to think about your transportation, you got to think about your food, right? And I would encourage you guys to go with someone if you guys want to do it abroad. Because you can split the cost. Like for me, I was very lucky to have my sister, so we split between the both of us, which is still expensive, but it's a little bit more bearable. Okay, and also it really depends on where you do your medical electives. For example, New York City will be very expensive, LA will be very expensive. If you pick like a more rural area, probably somewhere in Texas, then I think it's more affordable. Yeah, even in like Seattle, it's more affordable as well. And also another con of it is that it's not as hectic as the hospital life. This is very subjective, okay? And this is just basically based on my preference. This is because I'm a very I like to do my work fast and I don't really like to chill. For me, I work hard during my working hours, and after my working hours, once it hits 5, like I'm out. Okay, so I don't really like to chill that much in the clinic, and obviously it's not as busy as a hospital, so I feel like I wasn't really maximizing my learning when I compare it to my friends over here. But then again, it may not be a con for you, right? Maybe you like the hospital, maybe you like the clinic life. If you're looking into programs like family medicine, then you're gonna like it because you will have the opportunity to spend a lot of times with the patients, and it's pretty chill. So I would say it's very subjective. But then again, um as I think about it, my main goal over there, other than to complete my medical electives, is to network, right? So I gain in the expect in I gain in a way because I get to network with so many amazing people when I'm there. So it's not all about just studying the medical part of it. Okay. Um, okay, so talking about language barrier, there isn't any language barrier because everyone there speaks English. Only a few, probably like in a month, I only saw 3 patients who doesn't speak English. They speak Spanish, French, and what is one more? Spanish, French, and one more I forgot. But then it was okay because I had friends from those countries, so they took over and it's fine. So yeah, most of the patients there are very cooperative as well, and they're really, really nice. So yeah, that's it. Is it this? Yeah. So that's it for my talk about my electives in New York City. Thank you so much for listening and joining us today. If you guys are interested, I have a YouTube channel, Rebecca Ng. You can go check it out because I do a lot of medical student content, and I have a New York playlist where I have I vlog my entire journey over there. More vlogs are coming out, so you can go check it out. And if you guys are interested in the application process, you can click the lower left, which is the one I'm on the phone, right? I talk a lot about the application process over there. Yeah, so to wrap up my talk, I would say that my advice for all of you who wants to do your medical electives abroad, just do it honestly. Have if you guys can save up, and if you guys have the opportunity to do it, just do it. It's a little bit scary because you're going to a foreign country. You don't know whether your knowledge is adequate enough or not. You don't know how will you adapt to the system over there. But honestly, don't let your fears hold you back, because I was a little bit scared and nervous of studying alone there, because all of my friends, they had partners to do with during their medical electives in Malaysia, but I was going there on my own. Even though I had my sister wasn't following me to the hospital, right? But then I realized that honestly, nothing bad can happen. Like what's the worst that could happen, right? Like the only thing is people saying no to you. And even if they say no, or even if you get rejected or something, just put on a thick face and just let it go. Because honestly, like people over there, they may sound a little bit straightforward, but it's just them. They mean no harm. They're nice, okay? So just do it and just grab whatever opportunities that you have, and don't let fear hold you back, because growth is uncomfortable, but it's meant to be that way. So just do it. And also, I've seen a lot of medical students who are stressing out about everything, like literally everything. But my advice to all of medical students and also my close friends is to not force something. If something is for you, it will be for you no matter how hard you try to push it away. If you're destined to have that, it's gonna be yours. And if it's not yours, you won't get it no matter how you try it also. So really there's no point of stressing yourself out. Don't normalize don't normalize having mental don't normalize compromising mental health because as a medical student. because I see a lot of students who are medical students who are taking pride in that, like, oh yeah, a medical student made me so stressed out. I'm feeling so depressed. I feel anxious all the time. But that's what medical students go through. No, it's not normal. It's really not normal. And don't take pride in that. I don't believe in the hustle environment. Like, I feel like you can hustle, but please make sure that your mental health is protected as well. It's really not worth it to compromise your mental health for medical school. Medical school is just the start of your long career. And if you're and if it's really compromised at the start, then you might not even get to where you want to be. So don't let anyone tell you that, it's normal to reach that point that you're feeling like really low, depressed, anxious. Yeah, so that's it. Thank you.
Well, thank you, Rebecca, for this informative presentation. It felt really beneficial to those having doubts on their future as a medical student. So I hope this sharing session has provided everyone with some useful information. Now, without further ado, we can move on to our Q&A session. You can drop your questions down in the Slido link provided in the chat below. All right, so we have a couple of questions already. And your first one is, what are some other famous places students can do their electives in? Is there a particular place you wanted to go but didn't end up going?
Okay, very good question. So, if you're talking about famous places, I would assume that it's in the US. Okay, I'll just talk for the US first. So, as an international student, a lot of students go to Chicago. That's a really famous spot. And then they also go to Chicago, New York, and also Miami. Okay, that is very famous. If you're talking about outside of the US, then a lot of students like to go to the UK. Is there a particular place that I wanted to go but didn't end up going? I guess I wanted a hospital university, such as like Stanford, Yale, but honestly, I can't afford it. It's too expensive. So, yeah.
I see. All right, your next one is, what other countries can we do electives at and which is the most affordable?
You can do it wherever you want, honestly. I think sometimes your university will have affiliations with universities abroad, so do check it out. It's easier for you to go that route if you wanna do your electives abroad. For example, um, a prestigious university in the US only has an affiliation with University of Malaya. So students can directly transfer, but if you are not under the affiliation program, then you can't go. So just find out from your university if they have any affiliated university abroad. And also just look at it, like for example, if you want to go to Korea, just check which hospital has medical electives. Just write medical electives Seoul, Korea. All of the details will come out. Which is the most affordable? I don't know, but definitely not the US and UK because of the currency as well. Our currency is like dropping, so that too is a no-no.
Right, right. So, how do you manage being both a full-time medic and content creator?
Honestly, I try to divide my time. Like for the weekdays, I'm a full-time medical student. Then I spend a day during the weekend, like Saturday, to edit my videos and post on Sunday. I'm still struggling with it, honestly. I had a I had a better balance when I was a preclinical student because I had more time on my hands. But right now, since I'm going to the hospital almost every day and I have a lot of things to do, I'm struggling with it quite a bit. But yeah, I will usually set a date and a time frame for me to edit.
Mhm. So, life as a medical student, would you say you have the balance of life, or is it just 24/7 about medical studies?
I would say I have a pretty balanced life as a medical student. It honestly takes a lot of effort to reach where I'm at today. If you guys have been following me on my YouTube channel, I've talked about this multiple times that when I was a preclinical student, especially from semester 1 up until semester 3, everything was really new to me. I thought like if I lose a day of studying, like my life is done, like I will fail medical school. But honestly, a day or two won't hurt. Nowadays, I even take 7 days off if I'm allowed to. Like not when I have class, okay? When I'm on my semester break, like when I'm on my semester break, I don't study at all. Um, so yeah, I think what made me reach this point is because I realized that it's really toxic and I was getting really burnout. So I didn't want to have that life. Totally not 24/7 everything about medical studies. No.
All right, your next question is, you mentioned considering doing residency in the US. Do you know if degrees from all Malaysian med schools are accepted for the US MLE, or is it just IMU?
Right. So for this, okay, so in order for you to do USMLE, I don't think it matters which university are you from, but because USMLE is just like an exam, right? You just have to complete 3 steps, like step 1, step 2, and step 3, then you're done. But then again, I think there's a change. Like in order for you to be practicing over there, and in order for you to do your USMLE, you have to sign up for this thing called the ECFMG. Um, and recently, I think they changed our guideline. I think starting next year or something, if your university is not under the ones that they have listed, then you are not qualified to be registered in ECFMG, something like that. So that you have to go and check it out. I'm not really sure.
Mhm. On average, how much do you spend in a day in New York City? Make a YouTube video on the cost of living in New York for us.
For a day, okay, for a day, are you talking about the weekend or are you talking about the weekday? Because if it's
Is there a
the
big difference between the weekday and weekend?
Of course, like weekday, I'm only at work. I don't travel to Manhattan to to like explore and stuff. But okay, I'll just say okay, if it's on a weekday, if let's say breakfast I eat at home, lunch is free, okay guys. Just now I inserted a few food pictures. It's because lunch is always provided at my clinic, which is amazing. So I save on breakfast, I save on lunch. Probably I'll just get a cup of coffee. So that will be about $7, 21 ringgit, 21, 28-ish ringgit. So that's
Wow,
for the
for a cup of coffee is 21
I
ringgit.
know,
That's
I know it's
crazy.
really crazy. But if it's during the weekday, then I would say $2.75 for a one way to Manhattan to take the subway. And then over there, food costs about average $20 per meal. Coffee costs about $7, $27. And then I come back another 275. So about 40 dollars a day.
All right, your next one is, would you prefer doing residency in Malaysia or the US? And when do you have to start applying for residency in the US?
You guys are putting me in a difficult spot because this is recorded, so I can't really say like whether like which is better and all. But honestly,
I mean, your personal opinion, which one do you think is better?
I think I would prefer to do it in the US because I feel more respected over there. I feel that my opinion matters more over there. And also they have a great work-life balance. Okay, their residency program is really hectic and crazy as well, but it's still manageable. They still can take time off to do research if they want to, but in Malaysia, you don't have that luxury to take time off to do research. So you guys can gauge how much balance is that, okay? And then when do you have to start applying for residency? Okay, so the application goes like this. In June to July, they will open up their portal to applications, okay? So doesn't matter you're an international medical student or you're students from the US. June, July, the portal opens. You buy your token, your ECFMG token, and that token is for you to be eligible to apply for programs, okay? And then once it opens, you begin buying programs. So for example, I think the maximum that you can apply to is 300. Normally, they would highly encourage you to get about an average of 150 programs. And in order to apply that, you have to pay as well. So it's going to cost a lot. So it really depends on how much budget you have. I have friends who applied for 60 programs, 80 programs, 150. So it all depends on you. So the more you buy and the more strategically you um, plan about the programs that you're applying to, then a higher chance of you matching, right? Okay. Then in September, interview season starts. They will, based on the programs that you have, the programs will see whether they want to interview you or not. Okay. And then I think interview season is from September up until February, March the following year. Then March is when they will say whether you match or not. If you don't match, then you have to reapply, like a Rayuan thingy. It's called the SOAP, SOAP. Then see you will get it or not. If you don't get it, then you have to reapply for that season. So you have to restart again in July that year. So that's it.
And is residency the same as housemanship?
In a way, yes, because it's compulsory, right? But other than that, it's different. Because for housemanship in Malaysia, you have to do everything. Like you have to explore all of the different fields. For when you enter housemanship, it's a compulsory 2-year service. So when you enter that, you have to go through your core rotations such as OBGYN, gynae, peds, surgery, internal medicine. But for a residency program, because they're training their doctors to be specialists, you don't have to do general. So if like for example, if I apply to dermatology and if I get dermatology, I don't have to do other rotations. I go straight into dermatology. So I would say if you are someone who is really confident and you really know what you want, then it's good that you go for the US pathway because it's so much faster. For example, if I want to become a dermatologist here in Malaysia, it's gonna take me about 12, 13 years. But if I get into residency there on my first try, I'm a specialist within 4 years. So it really depends on what is your goal. So I would say that's the huge difference between housemanship and residency.
Were you able to transfer abroad only after your final year in IMU?
Transfer abroad as in the electives, is it?
Probably.
Are you able to transfer abroad only after your final year? Um, no, I did it during my 4th year, which is my second last year. Yeah.
Okay.
Hmm.
All right. So after doing hematology and oncology for your electives, would you like to specialize in that field?
No.
Okay. And did you apply for any scholarships?
For the US, no. Because honestly, I can't find any scholarships that sponsors medical students here to do abroad. So I didn't apply.
Okay. Were you younger than your peers in the US since medicine is an undergrad degree in Malaysia but a postgrad degree in US?
Yeah, I was. Um, I I was the youngest. I think I have a lot of peers who were already 27, 28. Yeah. But then again, there are a lot of other students from other countries as well. So some of my friends are like 24, but I'm the youngest in the clinic when I was there.
And how old were you when you joined medical school? Was it difficult living away from home on your own? I mean, even though if you had your sister, was it still a bit challenging?
How old was I? Medical school started when I was 19, right? Wait, 13, 14, 15, 16, 17, 18, 19. Yeah, I think I was 19 when I started medical school, and it wasn't really difficult living away from home because I've always been the type that I like to live far away from home. That's why I chose IMU. my hometown is in JB. I can easily choose Newcastle, which is really near to my place. But I really like the idea of living an independent life. So that's why I chose KL. And yeah, it wasn't difficult.
Mhm. And was there anything that gave you culture shock over there?
Yes, culture shock. Okay, not the clinic itself, but the environment when I was there in the US. Number one, guns. I'm so scared of guns, and it's really scary because after COVID, crime rates went up, shooting rates went up. So I will always check on my phone if I'm near a certain area that recently had a shooting. Other than that, weed is sold everywhere. You can see like everyone um by the streets who are like lifeless because they're high on drugs. So I think that was my main culture shock. Mm.
And what advice would you give to someone who's going to the USA to study?
Just do it. And just take whatever advice that I gave at the end of my talk just now.
Mhm. Can you give us some tips on how to manage stress?
First of all, I have first of all, um just know that everything will be all right. I think before you stress about something, when you're processing that stress, just know that in the end, everything will be fine because you have went through a similar stress in your life before. So this will be another time that you'll get through it. Having that positive mindset is already a step ahead when you're managing your stress. And then second thing is to list down what's stressing you out and prioritize them. Okay. Um, and then third, open up to people that you trust the most. Not everyone can be trusted. You can have 10 close friends, but those are close friends. Who are among the friends that you can really trust your vulnerability with, right? So for me, I have a lot of friends, but I only have a handful of them who I can really trust. So I always go back to them. I always go back to my sisters. So rely on people. Um, if you're someone who keeps everything to yourself, then that's fine. You can try that first. But if you feel that it's really unbearable already, just share it and just let it go. Because sometimes, we might think like, oh, am I bothering other people? Am I burdening other people because of my stress? And they really have the stress on their own. But honestly, if you have true friends, they really want to share that burden with you. So just do that. And also I talk a lot about stress management on my channel as well. So go check out my channel.
And what are the application criteria for the US hospitals?
Oh, okay. So it really depends. It really depends on which university hospital that you want to go. The basic ones, some they require TOEFL. TOEFL is something like IELTS, and then some require you to do your step one. Um, and then other than that, oh, I think a lot you have to complete all of your rotations already. So that's why I went after my fourth year because I'm done with all of my rotations. And then other than that, I think it's just insurance coverage as well as your vaccinations. That's the application criteria.
Mhm. How early how early on must we start applying to do electives abroad?
Oh, I would say start looking a year in advance. I started mine about 8 months in advance.
Mhm. And how do you network with your US medical peers?
I mean, just talk to them. I mean, they're no different from all of us, I feel like. Just be open because sometimes people there, they are very straightforward, but they have no intention of hurting your feelings. They have no intention of coming off strongly. It's just we Asians who are not used to that. So just don't take everything to heart. Yeah, just just make friends, it's fine.
All right, the next question is, I have completed my foundation recently and I'm having trouble for choosing med school between IMU and NUMED. and UMed.
Yeah.
Do you
Yeah.
recommend IMU?
Um, okay, so I think if you want to, okay, if let's say your goal is to go to the UK, then I think NewMed will be better because I think they have an exchange program. I'm not sure when do they get to go to the UK, but I think you have to do that. Mm, but then for IMU, we also have a lot of partner university as well. Like not only to the UK, we have Australia, UK, Scotland. There are a lot of partner universities, so I think your options will be more if you haven't set on any pathway. Um, yeah, I think IMU is a pretty good school. We have a lot of uh, of good lecturers as well. Pioneer lecturers. So I would say it's good.
All right. Do you need to do USMLE before applying for residency in the US, despite having graduated from med school in Malaysia?
Yes, you have to complete step 1 and step 2. Step 3, you can take it during your residency. Yeah, because that's just like a qualification exam. You have to do it.
And do you think dermatology has a good future in Malaysia?
Yes, because honestly, skin problems are on a rise. As you can see, there's a lot of rare skin diseases that are coming out due to mutations. Nowadays, global warming, tons of eczema, psoriasis because of all of this heat and all of this trigger. So it's really not, this field is not a dying field. And also, the skin is the largest organ in your body. So your skin tells you everything about what's going on the inside. So you will definitely have a good career if you successfully get yourself into dermatology in Malaysia. But in order for you to get there, it's really hard because there are not many dermatologists who are able to train you. So that's the number one reason why it's harder to get into the specialty here.
And what's your opinion about leaving Malaysia to practice abroad? Because this is always a debate among doctors and medical students here.
Um, I think it's good. For me, it all comes down to you. Honestly, I've never thought of leaving my country. I've always been the one who wants to stay back in Malaysia to give back to the community and to treat my patient. That's why I got myself into the medical field. I still want to do that, but looking at the circumstances, it really changed my mind. And if you think that you can get a better future out there, then no one's holding you back. Just go and do it. Um, because if you think about it, it involves your future and not anyone's else. So just do it. You can always come back when you're a specialist, and I think that would contribute more to the care of your patient.
Are students paid during residency? And if so, is the pay enough to cover cost of living?
Yes, you're paid because residency is like housemanship. Um, I would say it really depends on where you choose to do your residency at because the cost of living differs. Uh, if you work in like New York City, then your pay will be a little bit higher because the cost of living is higher. Um, but I think yeah, I think it could cover your expenses, but it's just that, you know, when you just recently moved there, you can't really splurge, you can't really enjoy life, but it's definitely sufficient. You just have to be a little bit thrifty. Yeah.
And which one do you think is better, practicing medicine in the US, UK, or Malaysia?
I think it all comes down to how fast you want to reach your goal and how sure are you with it. For me, because I really know like I want to do dermatology and I have backup plans. So if let's say I don't get dermatology, then I don't mind doing internal medicine because I'm also interested in um endocrinology, or I could take a diploma in dermatology later. So at least I have a really good idea of what I want to do. So US would be a good track for me because that's like really, really fast. But if you are not sure of what you want to do, you want to take your time to explore, then just go with Malaysia or UK. I really can't comment on UK because I know nothing about it.
Even though you didn't apply for any scholarships, are you aware of any scholarship opportunities?
For the US, no. I only know if you're from if you're from a Latin country, then you will have the opportunity to get the scholarship. But I never see anything that's open to other than that. Yeah.
Did you still need to apply to IMU after completing foundation in science like any other university?
Yes, I did.
And if I apply for residency in the US, does that mean I won't have to do housemanship?
Yeah. So okay, so you can either not do it at all or you can do housemanship halfway, then you go for your residency. But then you don't have to complete it. But after you're done there in the US, if you decide to come back, then you'll have to do an examination, I think. You have to take an exam and then you have to be attached to a doctor for I think a few months to make sure that you know of the protocols here in Malaysia. Then you can start practicing. Um, yeah.
And was it hard making friends since you were the youngest?
No, it wasn't because I feel like I'm actually an introvert, but when I'm alone and when I need to make friends, then that's when my extrovertness come out. I don't even know whether that's a word, but yeah, it wasn't hard. I got to make a lot of friends who I still keep in contact with until now.
Hmm. And do PMS schools have clinical electives?
PMS schools also have. Oh yeah, they do. If you're talking about PMS schools in IMU, right? Yeah, they do. Like my friends from Scotland, they will have different clinical electives everywhere. And then one of my best friend, she is studying in Aberdeen, Scotland. She'll be coming back next year to do her medical electives here as well. So they do have it.
All right. Is US MLE Step 1 hard?
I heard that it's hard because it's basically your entire preclinical knowledge. Yeah, so that's a lot to remember.
All right, here's the last question. How to look for clinical electives?
How to look for clinical electives? Like I said, you can either just go through an agency like 𝐴𝐧𝐸, that's the one that I went with. You can go for AMO opportunities, you can go for Brooklyn USC, and then you can also look up for the hospital that you want to go with and check if they accept any international students as visiting medical students to do their electives.
Okay. And yeah, with that, our Q&A session has ended. Thank you everyone for sending in your questions, and thank you, Rebecca, for answering them.
No problem. I enjoy it really. Yeah.
So the feedback form will be sent in the chat box now, and don't forget to fill that out, as certificates will only be given to those that filled in the form. By filling up the feedback form, you can have an input in TLPMC's future events and let us know how we can improve. We hope that this event has helped you gain more insight about studying medical electives in New York City and hopefully build some confidence and motivation that you need to attain this dream. Furthermore, as displayed on our screens right now, will be TLPMC's social media pages, which you guys can scan the QR codes and check it out to keep up with our club's events and activities. As always, thank you all for joining us here on a weeknight, and we hope that you enjoyed yourselves and had learned something from today's session. Oh, and don't forget to sign up for Med Memo. Important information and summary from each session is available for you to look back at any time. And yeah, we'll send in the Google form right now. All right, so once you guys have filled in the Google form, our event has come to an end. And again, I want to thank everyone for joining us here tonight. And yes, you may leave the call now. Oh, also don't forget to follow Rebecca on her social media pages, guys.
Yeah, thank you so much, everyone. Have a good night.
You too. Have a good night.
Bye.